بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أهلا وسهلا بحضراتكم في case of the week 2 on our channel for the passion. This is a case referred to my center for second trimester anomaly scan. The case has normal growth of the fetus, and here we will give a chance for every viewer of the video to give an opinion for this first image. What's his first impression? We will wait for 5 seconds. I'm sure that many of us have considered this as probably an abdominal wall defect with herniated abdominal content into fluid, but actually this was marked abdominal ascites when the baby has severe oligoamnios. When we looked for other fetal parts and the wall of the uterus, we became sure of this fact. Again, you will see the abdominal ascites, but the issue here, we have a sagittal view, and you will see that there is a hyperechogenic lungs. And also you will notice that the diaphragm is inverted. Actually, the diaphragm is not inverted in its normal anatomical appearance. It is inverted. Again, this video will show you a hyperechogenic lungs. Mesocardia with the cardiac axis rather deviated to the midline. And you will notice that the heart is displaced anterior, markedly displaced anterior, as normally you will not see the heart displaced that much distance from the spine. Also, you will notice a fluid bronchogram with bronchi beyond the heart seen filled with fluid, and the heart looks disproportionately smaller than the whole lung. Again, another video. And here you'll notice also beside the inverted diaphragm that there is a fluid-filled trachea behind the superior vena cava. Right here. Here again the inverted diaphragm and the abdominal ascites and the hyperechogenic lung, and you will notice the fluid-filled trachea and the fluid-filled bronchi beyond the heart. The fetal heart showed a tricuspid regurgitation with the regurgitation velocity more than 60 centimeters per second. It was here 120 centimeters per second. Also, on measuring the fetal kidney, it was just beneath the 5th percentile for the gestational age. To summarize, the findings were inverted diaphragmatic copulae, hypervoluminous lungs with disproportionately small heart, dilated fluid-filled bronchi and trachea, mesocardia. The heart is also displaced anteriorly, tricuspid regurgitation, severe oligoamnios. Fetal renal length is immediately below the 5th percentile for gestational age, suggesting possible hypoplastic fetal kidneys and marked fetal ascites. So the diagnosis is laryngeal atresia with possible Fraser syndrome. This is the laryngeal atresia is extremely rare, very low risk of chromosomal anomalies, but high risk of non-chromosomal syndromes, especially Fraser syndrome. Pathologically results from agenesis of the glottis, agenesis of the larynx, or agenesis of pus. Can be grouped into high airway obstruction syndrome, as it can be indistinguishable from tracheal atresia on sonographic basis. The possible differential diagnosis includes obstructive causes like tracheal atresia, tongue tumor or lymphangioma, airway obstruction or oropharyngeal tumors, and cystic adenomatoid malformation of the lung. These are rare cases, or less than 3% to be bilateral of the solid microcystic pattern. However, fetal ascites is usually not present, and it lacks the severely increased lung volume that is seen here in laryngeal atresia. The prognosis is very unfavorable, very high risk for intrauterine or early neonatal death. The very few survivors have been managed with the exit procedure. The detection of severe oligoamnios along with concurrent renal hypoplasia as well as associated tricuspid regurgitation further worsens the prognosis and raises possibility of Fraser syndrome, which has an autosomal recessive inheritance with a risk of 25%. So genetic counseling and the focused clinical exome sequencing are recommended. Other findings to suggest Fraser syndrome, not seen in our case, include microphthalmia, cleft lip palate, congenital heart anomaly, bilateral or unilateral renal agenesis. Also rarely reported was bacterial and 22q11 microdeletion. Other associated conditions include CNS hydrocephalus and malformation of the aqueducts, GIT esophageal atresia, bronchoesophageal fistula, tracheoesophageal fistula and atresia. Urogenital system, hypoplasia of the kidney, hydroureter, urethral atresia, vesicovaginal fistula, and bicornuate uterus. Skeletal system, varus deformity of feet, partial absence of cervical vertebrae, and absence of radius as well as syndactyly. The fetal ascites and tricuspid regurgitation are probably signs of congestive heart failure, and the oligoamnios can be explained by the obstructed drainage of lung liquid. Take-home message: a junior practitioner can be easily deceived by an initial appearance and continue to move in the wrong way, so always have a general look. You should see the whole elephant first before considering its ears as a carpet. Upper airway obstruction can be differentiated from microcystic adenomatoid malformation by markedly hypervoluminous lungs, inverted diaphragm, and lack of ascites. Kind regards and see you soon. Dr. Amr Farouk. السلام عليكم ورحمة الله وبركاته.